G'day guys, let's get into adductor related groin pain. Whether you're a weight training athlete, a running based athlete, or you have kicking and change of direction as well, adductor pain can be very debilitating as it most often comes on slowly but can stay for quite some time afterwards. It often involves many groin muscles distal to the pubis, such as the adductor longus brevis or magnus. These muscles work as a unit to move your hip across your body into adduction, some of which also have a secondary action to move your hip into flexion as well. So when we rehab adductor related groin pain, these are the planes of motions we want to focus on. The adductor squeeze is a great starting exercise for adductor related groin pain as it places early load through the tendon and muscles without movement. By limiting movement, we reduce the number of variables in the exercise, thereby reducing the chance of an unwanted flare up. Now, depending on your injury, you can push a little bit harder as symptoms allow. The adductor squeeze is a great starting exercise for adductor related groin pain as it places early load through the tendon and muscles without movement. This limits the number of variables in the exercise, thereby reducing the chance of an unwanted flare up. This exercise may help to reduce pain by warming up the adductors and also act as your first strengthening exercise in your rehab program. Now, you can do this 2 to 3 times a day, provided you fully recover from your first bout of the exercise. You can add in an abdominal crunch as well, which would be more specific to what happens to your groin when you're actually exercising or kicking a ball, for example. Now, we want to strengthen our adductors in greater ranges of motion. So doing your adductor squeeze in different planes of hip flexion and knee flexion is going to be more representative once again of what you do when you play sport. So start with your hips at the 45, working your way down to your legs and knees straight, and then we can have even high squeeze variations where we line our back, get a nice abdominal crunch, bring our knees right up, bring our feet right up, get a good squeeze, and then even come up with our feet off the floor, which is a very high level amount of adductor pressure. And so if you can tolerate these sorts of positions and get strong in these positions, it's quite likely that you're ready to move on to some more difficult and advanced type adductor exercises. Some great exercises from the Copenhagen camp with regards to adductor groin pain. The use of the single leg isometric adductor is a nice little gateway into doing some more greater loaded adductor motions. So as seen here, lying on your side, raising your leg up and down, just using the weight of your leg as the initial amount of load, and then progressing to using like a 2 kilo weight, progressing all the way up until 4, 5, 6 kilos, just depending on when you're able to tolerate the next progression in the exercises. So from doing the side on, we want to then move on to using the bench in an adductor clamp. So what you do is you set yourself up nice and close to a bench, knee on the bench to reduce your amount of load, and we're simply going to do an isometric hold where we're not doing any adductor type motions through range, just trying to simply hold our position here. It also doubles as a nice core exercise as well. Try to hold for up to 45 seconds, even a minute, as the stronger you get, the likelihood of you tolerating the next progression is higher. Now, this is the progression concentric eccentric, moving the legs together. This will work both adductors at the same time and is your introduction to more concentric eccentric work. Simply straighten the leg to add more load in these positions, but we'll then go back to doing isometric holds again until you can tolerate the load in this range of motion. Now, once again, when we want to try to increase the load, we can increase the lever arm again by coming further out as seen here, but do recognize that the further out you go, there'll be more pressure on other structures like your MCL, which is the inside of your knee. So if you've had previous issues with your knees, just be careful with this exercise. Now, to make it harder again, we just go back to our concentric eccentric. Now, this is extremely challenging, so make sure that you don't try to overdo it when you start. It's going to work both adductors again, and it's just an increased exercise from before. So by now, you've developed a really nice base level of strength and started to move through movement. Now, we can go back to doing banded adductions. Now, these would definitely be a suitable replacement earlier if you were finding the transitions from the isometric ball to the Copenhagen to be too much. But I quite like this as a progression after the Copenhagen, as we can start to increase speed through range a lot easier with the use of bands and elastic cords. Now, changing up your direction with your band is quite easy and very appropriate when we think about sport and how multifaceted our joints get into, especially if there's change of direction in kicking sports. So we can go in front of the body, go behind the body to try to mix up our range of motion. Now, we've got to remember that we're not just rehabbing a muscle, we're rehabbing a person that is trying to get back to a sport that does involve multi-plane movements. So hip flexion is obviously really important for any athlete that wants to squat, run, kick. So doing some progressive loading with bands in this direction is important as well. We can do it front on as seen here, and then go into a side on position where we adduct to load the adductors and then move our hip into a flexion type motion. Make sure you have something to use to balance. slowly going through range to get adductor loading through range, but also get some flexion through range as well. So this is a really nice exercise to start moving into multi-planar type strengthening, which is specific to the muscle that we are trying to rehab at the same time. I do think it is important to also consider eccentric loading in your rehab program as well, as the adductors do work in an eccentric fashion, especially in motions such as sprinting and kicking. Simply set yourself up away from the band, walk yourself out. In this case, I'm able to concentrically come out, but you might want to go even further, walking yourself out and then lowering yourself in. This means you're at a weight which is beyond which you can concentrically do, therefore maxing out your adductor's muscular output. So now we want to be thinking about sport and speed and replicating the positions our body is going to be in when we get back out on the sporting field. For someone that has to kick or run, this leg swing through or kicking type motion is a nice place to start. Set up the band so you get an adductor load and slowly start to swing your legs through, increasing the speed as able. Make sure you progress nice and easy as to not get a flare up from your first session doing it, but you should start to get an appreciation to what your adductor can do. We can then move on to a side-on leg swing or kick type motion. What we do here is try to be as variable as possible, changing the angles so that the adductor load varies on the adductor muscles. Try to work in high sets, but then starting to increase the speed, lowering the reps, and making it more of a quality over quantity type exercise. It's also worth considering that you should load your affected leg as the stance leg and not just the leg that's doing the kicking, as it also is required to do this in your sports as well. Do is start to incorporate more sport-specific plyometric loading. Now, they will definitely be doing kicking drills well and truly by this stage, but we also want to think about improving their capacity beyond which is required of them on the field. So by adding just a moderate amount of resistance, as seen here with the green tubular TheraBand, what we can do is just add a little bit more load, which will help to strengthen their muscle beyond, once again, beyond which is required of them when they're kicking on the field, thus improving their tolerance and making the capacity greater than their requirement. We also want to make sure that we're changing the angles and replicating different types of kicking motions that they would be trying to do on the field, making sure the athlete is following through and chatting with them about the technique that they like to use and that are they able to actually simulate that in the gym with us. So we've just done some instep kicking and then going through some laces kicking here. As the athlete tries to go through faster kicking motions, you may have to also think about dropping the weight down just a little bit. Try to make sure that the load that you apply isn't going to change their biomechanics too much. I found that by using this tubular TheraBand, there was very minimal change to my kicking style. It felt quite comfortable, but if you were to use something like an ankle weight, you would probably find it to be too challenging and too different to what an athlete would be experiencing without kicking without it. Now, please understand that groin rehab is very multifaceted and hotly debated in the rehab world. This video is only focusing specifically on adductors themselves, but certainly we need to strengthen muscles around the entire pelvis, muscles above and below, as well as any biomechanic or skill issues identified in the athlete.